Assalamualaikum. I mean, it's the credit goes to the Pakistan Health Parliament. Patient experience मेरे ख्याल में पाकिस्तान में बहुत सारे लोगों को पता नहीं होता था what is behind patient experience. और जो मुझे पता है कि this is like an operating system of any hospital. It's not inside the facility, it's outside facility as well. So there are the touch points. जो basically कहा जाता है 7. I don't consider 7. There are multiple touch points जहाँ पे आपने काम करना होता है. So this is the health checkup of any healthcare system के how they're working. So उसके outcome जो भी होते हैं, patient safety and the patient satisfaction के जब आते हैं. Historically इसको patient customer services भी कहा जाता है, patient services भी कहा जाता है. It starts from the call center to their media, social media or website to the discharge. यहाँ close नहीं हो जाता. Discharge के बाद follow up. So the link is outside facility as well. So they're responsible for outside and inside as well. So ये completely operating system बन जाता है किसी hospital का. So touch points are always different and difficult to maintain. एक touch point पे break हो जाते हैं, the whole journey goes in way के complaint generate हो जाती है. You cannot, stop any complaint system in hospitals. Even today in Cleveland, John Hopkins, वहाँ भी thousands of complaints generate होती है. And complaints are good indicator to improve your patient service journey. So this is my take on the patient journey hospital. I'll lay down. Add on something. The patient journey is very basically adopted in Pakistan. There's always a room for improvement. I see law hospital, they're working on it. But the real sense of the patient journey, I yet to see. It's a very modern thing which started, I'm not sure, exact number nahi pata hoga. But Cleveland was a pioneer in this thing. So luckily I went to Cleveland, learned about the patient journey and other things as well for 3 weeks. So I will add on more about what I learned from Cleveland, what healthcare is following Disneyland, the model on the patient journey systems, how things are happening in Pakistan, how things are happening in while I was working NHS, and the big transformation was in the Middle East. So Middle East is a morely lifestyle healthcare system. So they believe in patient journeys as well. So most probably I will add on value when it comes to patient journey. So this is what for me is a patient journey. I just want to add a couple of things on which Adil said, Mazhar said, and Fozia said as well. To be very honest, influx of patient varies from hospital to hospital. Every hospital have a different issues. So the बात मैंने की थी कि operating system you develop according to your patients. Okay, अब आपका patient dynamics क्या है, diversity क्या है. For example, if I have to compare one of the hospitals in Karachi, Jinnah or Shifa, there's a huge difference. So जो भी वो DNA जो path वो बनाएंगे according to their patient mix होएगा. So it's not about the expectations, it's about how you run your own business. So this is a patient journey. So what sort of patient we are getting? For example, rural areas के dynamics are different, the challenges are different. We have to create patient journey accordingly. Mazhar said it, रात को 2 बजे क्यों लग जाती है? Yes, it's fine. मगर how we going to treat them? How we'll have these touch points to be handled? This is important. So every hospital have a different. It's not a something generic. पेशेंट जर्नी एक्सपीरियंस कोई हॉस्पिटल डेवलप कर सकता है स्पेशली इन पाकिस्तान के डायनामिक्स में रूरल एरियाज हैं अर्बन एरियाज हैं एंड कम्स इन लाइक आदिल से राइटली सो रूरल एरियाज में एक मेंबर नहीं आता है पेशेंट नहीं आता है देयर आर प्लेंटी ऑफ पीपल दे कम अलोंग विद दैट पेशेंट एज वेल सो हॉस्पिटल ने अपना जो पाथवे बनाना है अकॉर्डिंग टू देयर पेशेंट मिक्स. So it's not one theory, not one thing. So you have to create operating system accordingly. So this is how you create touch points. So इसलिए मैं कहता हूँ 7 touch point नहीं हो सकते, 10 भी हो सकते, because the dynamic, the challenges hospital is facing it.
क्या this patient experience, is it a byproduct of the service, or do our organization's leadership, they have this feeling कि यार नहीं patient experience होना चाहिए, क्या उनकी इसके अंदर उनकी अपनी विलिंगनेस शामिल है? ये ठीक है, एक बिजनेस रन करना है, उसमें आपको पेशेंट एक्सपीरियंस चाहिए ही है, बिकॉज वो कहीं ना कहीं पे पेशेंट तो इज पेइंग, एंड इन इन प्राइवेट हेल्थ केयर वो इस सबको सस्टेनेबल कर रहा होगा आपके मॉडल को. तो व्हाट इज ट्रू?
I mean, the only way you can change culture and patient experience is the culture of every touch point, from security guard to your floor manager, the floor, FDOs, triage, doctor, and so it backward as well. If it's not coming from the leadership, it's not going to work. So leadership, they have to set example. Fozia rightly said, you have to create role models within system. How do I behave myself as a CEO of the hospital? So, मैं एक experience share करता हूँ. While I was in Cleveland 3 weeks की executive उस पे, one day I saw Dr. Todd. He's a CEO. He was a CEO. I don't know whether he's still CEO. He was pushing wheelchair. ये मैं eyewitness हूँ. I saw him. एक दिन पहले session हुआ था, and I saw him कि जब तक उसको आगे कोई पोर्टर नहीं मिल जाता, तो he was pushing that. So somehow session में मुझसे I asked him, as a CEO, how do you feel pushing wheelchair? I mean, उसकी जो statement थी, that changed my complete management in healthcare. Since that day, I feel everybody is a care provider. So that's a culture has to come from the top. Otherwise, it's not going to work. So how I carry myself, so this is important. So leadership से जब तक नहीं आता है, कोई भी change management नहीं आता है. So you have to change your behavior. You have to create role models. You have to create people they're following you. They do follow you. एक छोटा सा एक्सपीरियंस है मेरा मुल्तान में. मुल्तान इज अ चैलेंजिंग एरिया जहाँ पे इतने अच्छे प्रोफेशन नहीं मिलते हैं. मैं यकीन से कह सकता हूँ, जो प्रोफेशनल फ्रॉम द सिक्योरिटी गार्ड 6 महीने से 1 साल तक हमारे साथ रहता है, he behave exactly like the same we behave. हमने नहीं भी तो आराम से, मुझे याद पड़ता है कि 2025 में we did 30 कम्युनिकेशन प्रोग्राम जो simulation based पे था. We created scenarios, we acted like a security guard or patient. So triple E पे था: explained, engage and empathize. So every touch point was trained, retrained, trained and retrained. जिसने 6 महीने से 1 साल हमारे पास रहता है, we see that person is a robot. He's behaving like that he was asked to behave. So I learned that personally. I went visited Disneyland. Disneyland, they are known in customer services. And this is what when I asked them, how do you implement all these things? And the training director was saying, we create robots here. Robotic का मतलब है, they have to act every single day according to what they have been asked to do it. So if you go to Disneyland, आप जब भी जाएंगे, every face is smiley face. And they act exactly like the same, from the security guard to the reception to the any point, any touch point. You feel they are behaving exactly the same. They were told to do it. They never say anything else. They just have a template in their mind, CPU. They talk about this thing problem. If they cannot, resolve, they escalate to the next level. So this is what we have to do in healthcare system as well. Robot is a bad word. Human robot, maka they are supposed to do. They are being asked to do. Empathize करना है, explain करना है, engage करना है. So every touch point you have to train and retrain. जो आपके पास employee 6 महीने तक रहता है, they are not behaving. It's a failure of leadership. It's a failure of the hospital. So we have to invest in people. They are the support, run this operating system, which is the patient journey experience. It's not something until unless we will hospital will be running by robots. So I don't know कब आता है, मगर that has to come. So वो leadership से आता है. Leadership has to behave, and they train, investing in people. So we see people are behaving exactly the same they are being asked.